Aedes aegypti poses a great concern to our community because if this Aedes aegypti mosquito, which is non-native to our area and invasive in nature, gets established in our community, it will change the quality of life for all members in the community. In response to us finding the Aedes aegypti, we have deployed teams to help eradicate and that the Aedes aegypti will not get established here in our community. We have set out traps, we have done treatment, and done community meetings and press releases to inform the community of the potential dangers of Aedes aegypti.
These mosquitoes is very challenging to control because it's so adapted. They can adapt in a small little source of water. They are day bite mosquitoes. It means it's more challenging to find. And also since they lay eggs in very small container, it's hard to find the sources. These mosquitoes also, when they lay eggs, the eggs can dry and survive for months. It means no chemical can affect on those eggs also.
Here at the Public Health Department, our focus is on keeping communities safe and healthy. As part of that, we investigate all human cases of diseases that can be transmitted by mosquitoes. And here in our county, thankfully to date, diseases like Zika, chikungunya, dengue, and yellow fever, we only see in a handful of individuals who've traveled to endemic areas. Now that our vector control team is finding these mosquitoes, this invasive species here in our county, we're working with them to try to prevent the mosquito from becoming established, because if it does, that means that down the road there's a threat to the risk of everyone in our community potentially getting these diseases here locally.
The treatment that we have done and we are doing right now, we started with home inspections to ensure we remove any standing water or any sources that can hold standing water. And then we deployed team members to the area and we did a strategic treatment where it was localized to the area that we found Aedes aegypti. We're asking the community to do their part to remove any sources that can hold standing water, but also work collaboratively with our teams. As a long-term plan, we will be deploying surveillance teams and continuing monitoring to ensure that the Aedes aegypti does not expand its zone where we found it currently.